Welcome to Daily Series, COVID-19 Special. From an increased interest in injectables treatments for masks, here's how the coronavirus pandemic is changing how people take care of their skin. When COVID-19 cases began spreading rapidly and state-issued stay-at-home orders, dermatology offices closed their doors, and people stopped getting cosmetic treatments including Botox, fillers, and lasers. Some people with skin concerns like acne, a rash, or a worrisome mole turned to telemedicine to connect with their doctor over the computer. The pandemic also changed the way people thought about their skin, discussed their analysis of search trends on Google to see what patients were interested in. They found that people's searches for general skin conditions, like acne or eczema, skin cancer, and cosmetic treatments declined during the pandemic. For skin cancer and cosmetic treatments, interest hasn't yet returned to baseline levels. Some people are beginning to return to their dermatologist's office in search of help with acne, wrinkles, or that much-needed skin cancer check. Should you see a dermatologist during COVID-19? Regardless of your goal, before you see your dermatologist, determine which safety protocols they have in place. Are the staff wearing masks? Do they maintain physical distance in the waiting room? Are they sanitizing common touch spots more often? Depending on the procedure, you may or may not have to remove your mask. If you're getting Botox in your forehead and crow's feet area, for example, you can keep your mask on. But if you're getting a lip filler, you will certainly need to take off your mask. Importantly, if you're exhibiting symptoms of COVID-19 yourself, staying home and self-isolating. Even if you aren't showing symptoms, weigh the benefits and risks to your health overall with your healthcare team's advice, and let that inform your choice. With these precautions in mind, Botox in the eye area is becoming more popular. When you're out in public, wearing a mask to help protect others and yourself from COVID-19. Even though part of your face may be covered for part or all of the day, depending on your job, patients are still looking to smooth lines and wrinkles. Botox has become more popular in the time of mask wearing. That's because the area that your mask isn't covering, your forehead and eyes, is still visible. And what's more, there's more of a focus on this area. If you're worried that injectables will freeze your face so that people can't discern your expressions, well-done injectables like Botox should allow your smile to come through even if you are wearing a mask. Botox in the crow's feet area still allows for skin movement, so people will know you're flashing a grin. The main way anyone looks frozen or artificial with Botox is an immobile upper forehead, and that should never be done, with or without wearing a mask. Telemedicine was a growing field before COVID-19, but after stay-at-home orders shut things down, it exploded. We are where we would have been years from now because of the pandemic. Consider using your office's telemedicine platform to diagnose minor rashes, and for initial appointments where you might ask the problem look like I need to come in. It's best to have skin concerns checked in person so your doctor will be able to see the nuances of the skin bump, rash, or discoloration, but a video appointment is a good place to start, especially if you're wary about going in. When social distancing isn't possible, wearing a mask in public is a necessity to help slow the spread of the novel coronavirus. And yet it's tough when you experience a resurgence in breakouts what's being dubbed rosacea, and perioral dermatitis and acne-like rash around the mouth. Increased warmth and humidity within the mask provides an ideal environment for the bacteria that cause acne and for clogged pores, another cause of acne. The heat and humidity also aggravate rosacea or cause irritation that leads to perioral dermatitis. Doctors urges people to stop using oil or serum-based skin care products. For instance, if you're using an anti-aging retinol serum at night, switch to a more pure retinoid gel, like Differin Gel 0.1%. Stop any retinoid use at the first sign of redness or irritation, and experiment with applying the retinoid less frequently. If you have a choice, wear masks made of cotton, which is lightweight and breathable. If mask wearing is triggering rosacea or perioral dermatitis, visit your dermatologist. In the meantime, use mild, gentle products designed for sensitive skin. Masks can create nuisances when it comes to skin, but you can also use them to your advantage in certain situations. People seeking a plumper pout may choose to get lip filler, which involves downtime, the amount of time needed for recovery, of 24 to 48 hours. A certain percentage of people develop swelling after treatment. Call our doctor. Will likely ask that you limit physical activity during this time. The good news about wearing a mask is that you can go about your low-key daily activities until swelling subsides, and no one will be the wiser. Laser hair removal is on the rise. If you have bothersome wayward hairs on your upper lip or chin, laser hair removal is an option to permanently remove them. The laser damages the hair follicle, but a series of treatments is needed to stop growth. One drawback is that getting laser hair removal makes skin more sensitive to the sun, so it's often discouraged in the summer month. A mask will add an extra layer of sun protection for lasered facial areas when you're outdoors, and it disguises potential side effects, like redness or minor swelling. You'll likely need 6 treatments spaced 1 month apart and then 1 treatment a year as a touch-up, but you may not need to wait until fall to start. More people are turning to radio frequency microneedling. With fewer places to go and no big events on the calendar, patients feel like they can embrace this as an opportunity to get treatments that come with some downtime. Radio frequency microneedling is another of those treatments, and the microneedling causes minor damage to the skin with fine needles, which also promotes collagen. A radio frequency microneedling treatment combines the two. You may be red for a couple of days or your skin may appear pixelated for up to a week, she says, but the results are worth it. This addresses everything from texture to pores, wrinkles, scarring, discoloration, and uneven skin tone, adding that these treatments can be safe for all skin types. Skin cancer screenings are ramping up again. The Skin Cancer Foundation, SCF, recommends that people with a normal risk of skin cancer get an annual skin check exam at the dermatologist. If you're at a higher risk of skin cancer, your doctor will advise that you go more often. COVID-19, however, likely derailed many patients' schedules, and they're trying to catch up now. An influx of patients wanting to be screened for skin cancers if they have a history of skin cancer. Yet unfortunately, the fewer patients who have never had skin cancer are scheduling their routine screenings. Routine screening saves lives. 99% of skin cancers can be cured if caught early. Here's your helpful reminder to make a call and get on their calendar. Thank you for watching. See you tomorrow.